The way I see the situation on PBMs, I don't know why the hell they even exist. Now, they were set up for all the right reasons. Going to negotiate drug prices, going to pass along benefits to the consumer. But what I see them doing in my state, I don't think the consumer gets much benefit, and they're shutting down small businesses on Main Street right and left, and those are called our local neighborhood farms.
Look, I'm not opposed to anybody making money. It's a capitalist society. I get it and understand that. But I'm telling you, PBMs bring no value whatsoever to the healthcare system. No value. At least pharmaceutical manufacturers put money back into research and development. PBMs don't do that.
Today, healthcare premiums have increased faster than inflation. List prices for prescription drugs have gone through the roof, even though net prices have declined. And despite this increase in healthcare costs, life expectancy has remained stagnant. That means someone is benefiting, and it isn't patients. Look no further than PBMs or pharmacy benefit managers.
According to the government, these DIR fees increased by 107,400% from 2010 to 2020. This is not a typo. This is not a typo. This is a travesty. And you know what PBMs really stand for, Dr. Dwayne? It stands for pretty big markups. That's what PBMs stand for, and we've got to stop this.
I think more generally, what we've seen is that the types of conflicts of interest that you might be seeing in this market are, again, not unique to this industry, right? I think what we've seen across the economy is the emergence of these middlemen that can control access to markets, and then especially in instances where they become vertically integrated, there are all sorts of conflicts of interest that they face in terms of steering people to their own business and not to other businesses. We've also seen that once you have these middlemen gatekeeper, they can, hike rates or just change the terms of service, change the contractual terms. There's all sorts of kind of arbitrary conduct that can start to take place.
Truly astonishing in a capitalist economy. And that is, they are allowed to sell it at price X, and 3 months later they get a clawback saying you owe us money. How in the world is that fair? Seriously, how in the world is that fair?
I am proud of the work that Chansey Drugs has done over the decades providing health care to patients in my community. But PBMs put this important work at jeopardy, dictating who has access to our pharmacy, the prices patients pay, what reimbursements pharmacies receive, and what medications are on formulary.
Now, pharmacists are being driven out of business by PBMs and the cost of medicine.
One of the things I do want to talk to you about where I think we could really work together on access and affordability of prescription drugs would be PBMs. Okay, obviously our pharmacy benefit managers, which it's troubling to me that the three largest PBMs actually control 80% of the market. There's no transparency. They are making a lot of money by keeping rebates instead of passing them on to consumers. They exclude drugs from their formulary, and they are dictating what their competitors are making, right? And they're crushing my small mom and pop pharmacies.
Do you agree, as a representative of the PBMs, that it would be more fair to predicate out-of-pocket costs for what the actual pharmacy paid for that drug?
The PBM is there to work on behalf of the employer or the plan sponsor who's going to make the determination about those questions on out-of-pocket.
I'm here to work on behalf of the patient, okay? And what's good for the patient is that they are not paying co-payment rates that are predicated on the list price that nobody pays. It's a made-up price. It's literally fiction. And the only person who's exposed to it are my constituents. Why shouldn't they have an out-of-pocket cost that's based on what the actual transaction and payment is for goods delivered?
To the extent that we're deploying the savings delivered by the PBM, if you put all of that towards out-of-pocket costs, then you risk the potential of having an impact on the affordability of the benefit. It's a trade-off as long as the cost
over and over again, you point to the premiums going up. There's just no evidence to support that. It isn't true that the premiums have to go up if you're allowing, and indeed what we've seen is that out-of-pocket costs going down improve medication adherence. and lead to an overall healthier risk population.
Otherwise, it's a series of trade-offs, and one way or the other, the consumer pays, whether depending on the plan sponsor's design.
I think you just summarized the problem here. One way or the other, the consumer pays.
The consumer is paying a higher price, and we all know it. The spread pricing is real. We all know it. The percentage that they're being paid is a very real issue. The rebates are not going back to the consumer. We all know all those things. And anytime we try to step in and say, okay, so let's provide some transparency to find out what's actually how many dollars are there, there's some, oh, that's going to hurt the consumer, as if everything they're already doing is not hurting the consumer.